Hi, I'm Kiyan Gandhi, part of the COVAX team at UNICEF. It's our job to get COVID vaccines to every person living in lower income countries. That's 4 billion people, so it's a big job. So far, we've successfully delivered over 1 billion doses in one of the fastest vaccine rollouts in history. As of March, it's now year 3 of the pandemic, so I'll recap some of the key things that have happened so far and what happens next. The easiest way to think about this is in 3 phases, one for each year of the pandemic. In each phase, there was something we had to do. Year 1 was discover the vaccine, with hundreds of scientists all over the world working around the clock to find a solution. Year 2 was to make the vaccine, because once you've developed it, you have to manufacture billions of doses, enough for every person on Earth. And now we're in year 3, get everyone vaccinated. This is the most important phase of all, because it determines how long the acute phase of the pandemic is going to be. The longer the virus is floating around in unvaccinated populations, the more chances it has to make people severely ill. So, the faster we get doses, masks, tests, and treatments to where they're needed, the more lives we can save. The question is how? How do we get a vaccine to all these people? Well, the answer isn't simply that we turn up with the doses. It requires people, healthcare workers like nurses or doctors, and logisticians to make the movement of those vaccines from runways to clinics easier. It requires cold chain storage to keep those temperature-sensitive products potent. It requires communication efforts to let people know why it's important for them and their communities to get vaccinated. And of course, it requires a safe way to dispose of those syringes afterwards. In short, it requires an entire health system. And that's why phase 3 of the pandemic plan isn't just about vaccinating everybody. It's about taking the opportunity to improve health systems across the board. The way I think about it is cars and roads. You can build a car, but if there's no road for it to go on, the car's no use. COVID vaccine is a car, and the health system is the road. And once you've built a road, all sorts of cars can drive on it. In other words, the smart people also invest in roads. Now, at each of these 3 phases, discover, make, and vaccinate, the public had a job to do. In phase 1, for most people, it was just to stay home, wash your hands, and maintain social distancing. In phase 2, if you came from a wealthy country, it was to get vaccinated. And now, in phase 3, if you're watching this, your job is to tell your government to invest in health systems everywhere. My message for everybody is that better health systems protect us against COVID-19, but they also protect us against the next pandemic and every other illness along the way. As we emerge back from the pandemic, we have a once-in-a-generation opportunity to bring stronger and more reliable healthcare to more people than ever before. My dream is health for every child.